we'll talk about an important topic today, that is headache. Tension type of headache. Tension headache, also called tension type of headache. This is the most common headache which everybody faces. They say that 78% out of 100, 78 people suffer from this problem in their lifetime. Usually people from 15 years of age to 40 years of age, 15 years of age to 40 years of age, they suffer from this problem usually. Tension means it is not our tension. It is not our tension. Tension to the muscles of the head. So there are some big muscles in the head, from forehead to the back, neck, from forehead to the back there is a continuous muscle, and sides also the muscle innervates, big muscle over the head. It goes into tension. It goes into tension. Tension is not our tension. Tension to the muscle. The headache will be like somebody is gripping your head. It is like gripping, and it is not very severe. It is mild to moderate. It is mild to moderate. It is gripping in nature. Usually it is muscle related only, not related to your any other problem like migraine or other things. This is both the sides. Headache is both the sides of the head and back and neck also. Whereas in migraine it is only one side. Only one side of the head. Migraine is only one side of the head. And one more thing is, it usually any depression, any anxiety, any problem with the temporomandibular joint, this joint, when there is any problem with this joint also, this problem can come. And usually if you lie down in a wrong position, if you are in flexed position, you are seeing a TV, you are seeing a movie, you are reading a book, and you are in wrong position, that is you are very much flexed in the sofa or any this one chair, you are sitting like this and reading. If the neck goes into flexion for a long time, you can have this problem. You can get this problem. And one more thing is hunger. If you are hungry also, this pain can start. And dehydration, if you are not taking proper liquids, proper water or proper liquids, dehydration can cause this problem. Hunger, dehydration can this problem. And if you don't have proper sleep, also you will have this problem. If the sleep is not proper, you can have this problem. And so many other reasons. Sometimes vitamin D deficiency, if the vitamin D is low in your body, it can cause this tension type of headaches. And the other thing is, if vitamin D and B12, if both are also down, both are also less, you can get this problem. So these are all the types of tension headache we are talking about, why it comes. Usually it will last from 30 minutes, sometimes up to 7 days. 30 minutes to 7 days. Okay, the pain can be from 30 minutes to 7 days, but average is 4 to 6 hours. The pain, once it comes, it lasts from 4 to 6 hours is average. And one more thing, you can divide it into episodic and chronic. Episodic means it comes in episodes. It comes once in 2 days or once in 3 days. It stays for about 1 hour, 2 hours, like that. It will go. That is episodic. Chronic means it will continue. It will continue. Chronic, you can say, when it is more than 15 days. When it is more than 15 days, you call it chronic. And sometimes it can last for 3 months. Usually 15 days, 3 months chronic headache, maybe because of vitamin D being low deficiency and vitamin B12 deficiency also. These two can cause chronic headaches. There are other reasons also which you have to be very cautious. And one more thing is, there are some red flag signs, and where you must be very cautious. You should run to the doctor. Red flag signs, that is, it is called as Snoop 4 signs. That is, once you have any problem with the eyes, your vision is altered, you are not able to see properly, or your visual, there is any change in the visual pattern. So there may be some papilledema, that is the retina inside the eye, there is some swelling. So that also can cause this headache. So you have to definitely go to the doctor immediately. Neurophysician first. And If the headache comes after the age of 50, if the headache comes after the age of 50, and usually it is 15 to 40 years, but if the headache comes after the age of 50, you have to definitely consult a doctor immediately. And one more thing is, if there are any neuroscience, if there is any neurological signs like the hand or the leg, any neurological signs, you find that is this is the nerves are getting involved, immediately you must go to the neurophysician. That is also involved, neurological deficit we call it. All these are red flag signs, and treatment is very simple. Usually Dolo 650 will be enough for this headache. If Dolo 650, if it is not getting relieved with some Dolo 650 or paracetamol, then you must add caffeine also. Caffeine is also important. So Dolo, paracetamol with caffeine also will relieve the problem. Sometimes you need muscle relaxant, chlorjoxanone, like things like you have aciclo-MR, diclo-MR, such tablets. You may need such tablets sometimes. Most of the times, some Dolo 650 or paracetamol is enough. Sometimes you may need paracetamol with caffeine, and some other times you may have to add this one muscle relaxant also. So at that time you have to go for aciclo-MR or diclo-MR. Some newer drugs also have come like that. And if the headache is lasting for a long time, tricyclic antidepressants will also be added, like amitriptyline. That is, amitriptyline is one drug which most of the doctors prescribe at bedtime, and the tablet is called Triptomer 10 mg. Triptomer 10 mg is one tablet most of the doctors keep at bedtime, so that it will relieve these type of headaches. But one thing we should remember, if there are any red flag symptoms, or if the pain is not coming down in spite of medication, so please, you have to go to the neurophysician. You have to evaluate. Sometimes a CT scan, MRI, etc. will be done. If the symptoms persist, usually there won't be any vomitings in this, no nausea, no vomiting, and it is both the sides, not very severe. Gripping in type, somebody is pressing the head, and it comes from the starts from the forehead to the back, neck also. It extends to the neck and sides also of the head. These are all the symptoms.